Arpita is a consultant clinical psychologist in Manoshanti, Pune. She's a licensed clinical psychologist from Manipal University. She's an expert in psychological therapies for children, adolescents, and adults. She's going to talk about some common behavioral problems expected in children and how to, keep children positively engaged. And I think this is the most interesting topic of the hour and on everybody's mind. So yeah, over to you, Arpita.
Hi, good evening, everyone. Thank you so much for joining. Kindly do let me know if you're unable to hear me. This is great. I think, the topic that we are covering today, what Dr. Rishikesh and as well as Dr. Smita just covered are absolutely necessary. They have, in fact, made it a lot more easier for me because I can just, be like, okay, we have spoken about this and covered the rest, right? So today, what I will be talking about is generally what I have observed in my clinical practice. The difficulties that mostly the concerns that parents raise, as well as the whole bit about how the pandemic has brought in so much uncertainty for adults, of course, because they have to manage their office, their household chores, as well as children. So we're understanding how as adults we're definitely having a lot more work now because we're managing work from home. There is, of course, house related work that needs to be done, and children, because now they're at home, schools are closed, there are online classes going on, so there's an increase, screen time, decrease in physical activity, as well as generally a disruption in day to day routine, right? So what is the question that I come across the most is that since schools are closed, and there is an important focus on social distancing, right? What would be helpful for parents to include in their daily routine, keeping their children at home? So here is where I'm going to be talking about individually what can we do, as well as for small children as well as teenagers, what are the things that we need to do generally to help them out. So individually, of course, we're all going through a lot of uncertainty, right? There was a recent review in the month of March. The Harvard Business Review said that we're all collectively grieving the loss of what the normal was like and what the new normal is going to be. Correct? So it's very important that we keep a structure. We have a schedule during the day, because with all this uncertainty, knowing what we have to do now and a little while later brings in some certainty, right? It's very important to communicate. When you are at home, you're managing your children, you have work and so on and so forth, it's important to let your family know what you're going through, as well as, if it permits and if you can, talk to maybe your colleagues at work about if at all you're having a difficulty. Let me just give you an example. Suppose you have a really small child at home who can walk into the room while you are in a meeting, right? It's always better to let your colleagues know that it may be that my child may come into the meeting and may require me, so I will finish that and get back to you as soon as possible. Sometimes all we require is to communicate. Next, it's very important to have boundaries. Now, what I mean by boundaries is, okay, these are my work timings. If I know there is an important meeting and I think my children are going to understand that I have this meeting, it's very important to let them know. It can be as simple as, what, mama or papa just has a meeting right now. So how about for the next maybe 15-20 minutes or half an hour, you could give me some time, unless there is absolutely an emergency. So it's very important to establish those boundaries. What has also been found to be very beneficial is how parents can maybe leave a sign on the door which says that, okay, maybe they are busy and the child needs to come into the room, maybe not making a lot of noise, if at all it's a very important meeting, unless obviously there's an emergency. Taking adequate breaks during the day. Sometimes what happens is you're working throughout the day, then you're doing your household work, and then you're coming back and you're sitting with your child to do their homework. Always remember, you cannot pour from an empty cup. You need to fill your cup to be able to help your child out and be productive at work. When it comes to both the parents working at home, it really would be beneficial if there can be alternate shifts taken by parents. So suppose there is an important meeting by one parent that needs to be attended, and at that time the child also requires the parents' assistance, it can be managed in that manner wherein there can be an alternate shift. When it comes to very, very young children who constantly require your care, it can help that you can maybe get up a little or wake up a little earlier, catch up on your work just before the children wake up, if that can permit, right? It's very important on an individual level as adults to increase our self-care to be able to, provide for our children as well as get the work done. Also understanding that maybe at an adult level, if the same routine can be established in terms of having meals together, having an exercise hour, that takes the load off you, because you know what, sometimes if everybody has a different meal, you may need to be available to maybe serve your children, then go and have a meal by yourself and so on. So if these activities can be clubbed together, which can almost be like a family ritual to, touch base, talk about how the day is going and so on, that can also be extremely beneficial on an adult level. Now I will be telling you about what can be done when it is small children. How do we go about helping them out? Again, what we definitely need to remember is structuring, having a consistent daily routine which has structured activities which need to be done, as well as what are the free times during the day that needs to be in place, right? It's also very beneficial if you can do that, because you yourself are a model for your child. They are going to see how you're going about your day, they're going to be seeing what you're prioritizing and so on. If you maintain safe distancing, especially when it comes to really young children, in terms of not going out a lot, maintaining distance, washing your hand frequently, these are good habits that your children need to learn, given that they're playing all day long and we don't know where they are, despite how much attention you would keep on them. Expressing gratitude as well as positive statements in terms of praise and appreciating children whenever they do small things, right? It's very important that children now, given that yes, initially it was when their classes were not there, but now they have classes, but they might finish their work and might still find a lot of time free as to, and constantly come and ask, okay, what do I do? I'm really bored, I'm missing my friend, so on. It's likely to hear, you're likely to hear these things. Involving them in household chores is very important. Give them small work, that is setting up the table, making their bed, or picking, getting the clothes once they have dried from the balcony, or maybe just cleaning up, or picking up their toys. General household chores can be given to the child so that they know they need to do this every single day. Sometimes having family games, for example, as simple as Ludo or Snakes and Ladder, or maybe Jenga, right? That can be played with children to keep them occupied. And it's a wonderful bonding exercise as well, right? For very young children, cooking without fire can also be very, very involving. Get them involved to, make things. They also feel that they are being involved. As well as reading. We underestimate the importance of reading, but right now is the time when it can be encouraged, right? Get them involved, get them to read. And if they're really young children, read to them, because this itself can be extremely beneficial. When it comes to teenagers, what happens? There's a lot of difference, right? It's very easy to tell your small kids to, okay, just help me around, or maybe make your bed and so on. But when it comes to teenagers, it's different. Their needs are different. So that is where I have noticed most parents have difficulty, because, well, this is the age group. Teenagers are the age group who will definitely miss their school a lot more, will miss hanging out with their friends as well as socializing. So here is where you have to definitely increase your support when it comes to this age group, as well as giving them the space to express themselves individually, right? Ask them, talk to them, what is it that they want to talk about, right? Spending time with them, sharing responsibilities. Yes, household chores are one thing that can be done, but this age group really likes to be individual. They want to take charge, they want to do things, right? So give them that. Let them, also be part of decision making. Sometimes even basic budgeting, for that matter, you can ask your children to, if they are teenagers, to come and help you out, right? Very important, again, to make routines, managing stress talk, because they're likely to also experience a lot of anxiety. I will be talking about what are the signs that we need to look out for. Also paying attention to how they can be safe on an online platform, right? There is so much time currently with respect to maybe talking on WhatsApp with their friends, maybe playing a game together, or maybe being on social media, attending their classes. We may really not know what our children are maybe what experiencing online, right? So it's very important, and I will be giving you a few tips with respect to that as well as monitoring difficult behaviors. These difficult behaviors are very likely to take place. They're very normal. Sometimes the children can just be very simply tired, hungry, afraid, or just for that matter experiencing a lot of emotions, right? It's important to notice these behaviors and have a genuine conversation with them. It's very likely that parents may use the other term of, hey, don't do that, or I don't like this behavior. But simply rewording yourself and saying that it would be nice if you could behave in this manner sometimes can be very, very helpful, and a teenager is likely to reciprocate to this kind of attention. Now, generally, of course, we understand that this is how children, us as individuals and teenagers, can be occupied. But what are the significant distressing or behavior changes that we need to observe when it comes to children? Why is it so important? Is because we as adults are a lot more verbal and can definitely talk about, hey, I'm feeling sad, or I feel really bored, or I'm just feeling anxious about how my work or my presentation is going to be like. Children may not necessarily do that. Their way of expressing stress is a lot more different. So what is it that you as parents need to look out for if the child is being so like I was talking, there are a few signs of distress in children that we need to definitely observe. These are negative behavior changes that children may definitely display, as they may have some difficulty in verbally expressing what they're going through. So a few things that we need to look out for definitely is irritability as well as moodiness. If your child is definitely showing these kind of behaviors, it's probably that they're stressed or they're experiencing something. Withdrawing or not enjoying activities that they used to previously enjoy. Expressing worries a lot more frequently, a lot more routinely, right? There is an increasing number of maybe complaints with respect to school or with respect to friends, family members, is what is also to be noted, right? Are they being a lot more fearful than usual? Have they started to stick around a lot more when it comes to maybe a specific teacher, a friend, or you as a family member? Do you notice that there is some changes when it comes to appetite, or as well as sleep? Is it that they're sleeping a lot more than usual, or has the sleep significantly gone down, or are they not enjoying their meals like they used to before, or they have stopped, or they're eating a lot more? Are they avoiding to have conversations with you, significantly avoiding to interact? Is there an increased amount of anger when it comes to specific family members or all the family members, right? These are a few things that we definitely need to look out for. Apart from this, a few things that we may also notice are children complaining of feeling sick. That is, that maybe they're having a lot of stomach pain, headache. Is this related to specific situations? Is it across all situations? Is it that it only happens maybe before a test or before going to school? Are things that we need to notice, because these can definitely be signs of stress. Also trying to maintain a parent network wherein you can speak to other parents and find out if their children are maybe noticing any change when it comes to your child who's maybe not talking a lot more, because they might be interacting very normally with you, but they might not be the same with anyone, with others as well, right? That is what we have to notice. Additionally, you have to decode over here, because sometimes children may say that hey, I'm worried, or I'm really confused, I'm angry, I'm feeling very, very annoyed. These are all signs of stress in children that we need to definitely notice, right? Certain negative statements also, like no one likes me, I don't enjoy school, or I just feel I'm not a good student, nobody likes me, or nothing is fun anymore. If these statements are made regularly, persistently, along with or without the previously mentioned changes that I have mentioned, you definitely need to get professional help, because sometimes talking to a therapist, although it might seem a little scary in the beginning, a therapist is able to provide a safe place for your child to be able to express their worries. Try to look at things which we may, of course, we would want the best for our children, but sometimes children also feel a lot more comfortable in a therapeutic setting to talk to a psychologist who will be able to understand them a lot easily. Right? So these are the signs of distress that we definitely need to look out for. Again, this is again what we're noticing on a day to day in this time wherein social distancing needs to be maintained. Another thing that we're all very frequently noticing, and there are a lot of doubts about this, is the screen time. How much is okay? How much is not okay? When should we stop? Or, is screen time okay when it comes to maybe classes which are going on for 6 to 7 hours in a day, and then they want to watch a show or they want to, chat with their friends? What do we do about this? So, what I have definitely noticed in my clinical practice is that most parents have difficulty trying to manage screen time because one, they're having difficulty in this pandemic trying to find other things which can be entertaining for the child. They're exhausted with their work as well as managing home, so at the end of the day it becomes, and it's so normal for you, for you to be tired at the end of the day, to just allow a little bit more screen time than normal. Or there are certain things that need to be done at home which require attention, and maybe the child can come and maybe not get you to be able to do this work the way you want to, right? So these are generally the worries that parents express, or the concerns revolving around what do we do, how do we stop the screen time. So there are a few guidelines which I'd like to share with you, which have been given by the World Health Organization along with the American Academy of Pediatrics, who say that um, 2 years and younger than that, there should be absolutely no screen time that should be given, right? Children who are between the ages 2 to 5 years should be allowed maybe maximum 1 hour every day. Less than that is what is obviously very important. This is what we're talking about, maximum that can be. When it comes to older children, here there are a lot more things that we need to consider. But when it comes to teenagers, it's very important to sit down and discuss, basically negotiate and discuss the limits that when it comes to, uh, using the screen time. Now, what has research shown? That research has shown that except for maybe attending their classes all day long, they have found that children are spending about 5 hours recreationally using screen every single day. And they have also found that children who were maybe spending this much time watching things online have reported a lot of there's obviously an increase in calorie intake. There's a lot they're a lot more into junk food. There's definitely decreased physical activity because of the increased screen time. They also report of increased anxiety as well as low sense of well-being, low self-esteem generally, that is also being noticed. So what exactly is adequate now, right? We've understood for really small babies and infants, what toddlers, what is okay. But what about children who are probably preteens or teenagers? What they say is best for mental as well as physical health: 1 hour of exercise each day, sleeping for about 8 to 10 hours every night, and recreationally using screen for less than 2 hours is the best recommendation that across platforms, across researchers has come up. This is extremely important because you're seeing that you cannot, sometimes it seems like, okay, we're going to just allow the children to watch, or attend their classes online, but they're not allowed to do anything else. But it as parents, we really need to understand that simply banning may definitely backfire, because we're living in such a tech generation, right? We're hyper connected. This is what is extremely important because this is what is making us stay in touch, right? And it's very important for children also to somewhere learn how to self-regulate. How much time is important for them? Today you sit down with your child and be like, okay, you know what, we're deciding that apart from your classes, you're allowed to maybe spend 1 hour maybe playing a game or maybe talking with your friends, all combined, all rolled into one. You're supposed to, let your child also take up some responsibility and say that, okay, you know what, this is my time and my time is it. I'm not going to spend any more time. Because what they found is that sometimes when people or parents try to micromanage the time in the sense, okay, you know, you're not allowed to do this, or you're only allowed to you know, attend your classes online because, well, your concerns are valid, how much time should the child be spending online, it may interfere with the child's ability to learn to regulate themselves, that how much do I decide what is good for me. They should be given this opportunity to do that, as well as also understanding that less than 2 hours every single day recreational use is what is okay. Anything more than that, we can definitely see in this pandemic, it can definitely cause detrimental effects. We are noticing, and like Dr. Rishikesh mentioned, there's an increase in, you know, the number of psychiatric illnesses that people are experiencing because of loss of normal, anticipation, so much fear, and so on. So for children well-being, this definitely needs to be taken up by parents. So what do you do in terms of this screen time? Keeping an open line in terms of communicating and discussing with them how much you feel is okay. Spending time, like we have previously discussed, in terms of what is normal, keeping them engaged, are simple, good parenting and definite signs to, you know what, maintaining a healthy relationship with your parent. Another two things quickly that I'd like to discuss with you is sleep. Right, sleep is very important. We have previously discussed, and we do come to know that it can definitely cause a lot of daytime, you know, tiredness because children are not going to bed on time. There's poor health. There can also it can also lead to, you know, a weaker immune system. There can be mood disturbances, lot of irritability or general grouchiness that may be there. So it's very important as parents to also bring this basic in your structuring during the day, along with meals as well as exercise and screen time, right? Next, because children are spending so much time online, right? It's very important to, you know what, keep them safe. Because yes, we understand that it is very important to attend classes and so on, but you need to set up parental controls. There should be safe search options, there should be privacy settings, there should be healthy device use, like we have discussed, as well as device free spaces at home. You need to have certain spaces where there are no devices allowed. It could probably be at a dinner table, or maybe after that when, you know, the entire family is coming together to play a game. Now these are all very important things that you need to incorporate when it comes to your children. Also helping them understand at a young age what kind of information needs to be kept private, because once things go online, they stay online, right? So they need to be told about this. And as parents, a few things that you definitely need to notice in terms of signs of distress is, if they are being too withdrawn, that is, they're keeping to themselves, they're spending a lot of time online, they seem upset, you feel like they're not sharing things with you, as well as, you know, they're, like I mentioned previously, spending too much time online, are signs that definitely need to be noticed. So keeping all of these things, understanding signs of distress, understanding how you need to keep yourself and your routine and your cup filled to be able to help your children in these difficult times, and that should help. And definitely do not hesitate to get professional help or some guidance, because like I always say, therapy is not just for, you know, illness, it's also for wellness, and maybe you could be equipped with certain strategies which can help you manage children in these difficult times a lot better. Thank you.